time to talk about the final M in managing diabetes in pregnancy, and that's medication. You're managing your diet, we're monitoring your baby, you're moving your body, and it can be very frustrating to see your glucose is trending up even though you're doing all the right things. But this is a pretty normal thing to happen in pregnancy because the placenta is making a lot of hormones that just make you more insulin resistant. So for some people whose glucoses are elevated despite doing all the right things, it's time to talk about medication. The two medications that we use most commonly in pregnancy are a pill called metformin and injectable insulin. So if your glucoses are mildly elevated but nothing we're doing is managing to get them down, we've added bedtime snacks, we've added another 10 minutes of exercise, we've added more protein to your diet, but your glucoses are still up, metformin might be a good choice for you. Metformin works in several ways. It helps keep your body from absorbing a lot of carbohydrates from your food. It helps keep your liver from releasing glucose and glycogen into your body, so it helps keep your glucose levels low. And it helps make your muscles more sensitive to insulin so that glucose can move inside the cells more easily. If it's just your fasting glucoses that are elevated, insulin at bedtime may be the perfect choice for you to get those fasting glucoses down. Insulin's very easy to draw up and inject, and in fact, most of the time it comes in a device called a quick pen that looks kind of like a magic marker, where you twist a needle onto one end and dial in your dose at the other end. It hurts less than doing finger sticks, and you will very likely be able to come off of this as soon as you have your baby. If you have type 2 diabetes and you were already on medication prior to the pregnancy, then you'll probably need to continue medication after the pregnancy. If you were on a medicine that we don't use in pregnancy, if you were on a semaglutide like Ozempic or Mounjaro, you can't take that during pregnancy, but after you have the baby and after you finish breastfeeding, you might be able to go right back on that medication. And if you have type 1 diabetes, you are probably on insulin, and you're on insulin during the pregnancy, and you'll be on insulin when the baby comes, but at a much lower dose. Your insulin dose in pregnancy will go up, up, up. Sometimes it's alarming how much your insulin requirement will go up during pregnancy, you type 1 diabetics. But after you have the baby, usually we cut your dose in half almost right away, and then your dose should continue to go down if you continue eating well, moving well, and managing your diabetes the way you should. Remember, if you start on medication, this is not a failure. If you're doing all the right things with your diet, sometimes you just are still a little bit too insulin resistant to do without medication. And once you start medication, it can be a lot of fun to see your glucoses responding to your diet a little bit better. So it just makes it a little bit easier for you to make the right decisions and then get the results that you want. Make sure you talk to your provider and make this decision together to start medication. So that's it, the 5 M's of managing diabetes in pregnancy: measurement, meals, movement, monitoring, and medication if you need it. I wish you all the best in your pregnancy journey, and I hope that these M's are a good way for you to organize this information and address what you need to do to take care of your diabetes in pregnancy. Feel free to go back and review as much as you want. Sometimes it takes me a few listens to be able to feel like I have something down. Thanks for watching. This channel is all about pregnancy and all the wild things that can happen before and during and after you have your baby. So stay tuned for more.